A 33-year-old female patient who was not satisfied with her previous smile procedure wished to have it corrected and improved. A study on her condition showed a canted midline, an asymmetrical tooth size, and a rotated anatomy, which gave an unnatural appearance. Guided by the digital smile design, we were able to predict and do a diagnostic wax-up and test it against the patient's mock-up. Monoshade full upper anterior veneers was also created. To enhance the beauty of the teeth, careful finishing and polishing were done to bring out the macro and micro textures. Thanks to the procedure, she's now more confident of her smile for her job as an actress and a performer. This same smile now brings joy to the people she meets around her.